When you talk about moms, you talk about somebody who laughs with you, somebody who cries with you, somebody who is there to kind of give you focus and direction. There's that unconditional love that is always there. She lived in the assisted living about a year and a half. Her kidneys kind of started deteriorating and wound up going to the hospital, and it was determined then that she wasn't going to be able to live by herself anymore. And with that came the realization she was kind of failing.
My favorite sociologist says that you've never become an adult until your mom dies. So we walk into a room and guess who it is? It's Mom. And for the one sitting in the corner, it's my mom. And so now everything matters. And they look at life differently. And they are so concerned that their mom is treated with the greatest of dignity and respect, that they're loved like they would love them, and everybody feel good about that moment, or at least as good as we can, given we're talking about life and death.
I don't know if all hospice is this way, but Heart and Soul Hospice, they're concerned about the whole person, not just the physical health of the person, but the emotional, the psychological wellness, not only of the individual, but also of each family member too.
I think the biggest misconception that people have about hospice is that it's for a short period of time. Hospice is designed for us to get to know the patient and become a part of their family group. So they trust us and they trust our decisions that we help them make. We don't come in and just start providing care and doing what we think is best, but we want to make sure the family and their primary physician is on board to provide that care and what everyone thinks is best for that patient.
Hospice in general is probably one of the most beneficial things that a family or a patient on their own can decide. And since there's many options, you don't necessarily want the biggest. You want the one that you know gives the most personalized and the best care. I refer to Heart and Soul Hospice because they care about their patients, and I know I don't have to worry about what kind of care the patient's getting or what kind of assessment the patient is getting from this nurse. When I get a call from one of those nurses, I know it's spot on.
Some of the patients and families have had these doctors for 20, 30, 40 years. We want to just be an extension of that primary care physician. We are an intimate group, so we were able to communicate those needs with that physician.
There has to be constant communication, not just with the primary care physician, but with their nurse practitioner. Without that, you cannot give them the best care possible, and that's what these people deserve. Scariest times of their lives, for the patient, for their family, every single person in their family, that's a scary thing because you're faced with the reality that, they are terminal. We get to come on and like I said, we get to help walk them through that process so it's not so scary. So that not only is our patient at peace with where they are and where they're going, but so is that family.
The one thing that I would like to say about my mom is that I hope and I know that she's getting the best care that she can get. And I'm thankful for that.